Hi, I'm Chelsea Shupe, and I'm a social worker here at Holton Community Hospital. My role is all about supporting our patients and their families in ways that go beyond their medical care. Every day is a little different, but I'm here to make sure everyone gets the care and resources they need. When I'm working here with patients, my biggest role is to be their advocate. I go in and I meet with them and I do an assessment, and I just try to figure out what's the most important thing to them and how I can help achieve that. So from the very beginning, we're starting discharge planning, and I advocate throughout that whole plan. So whether that's helping them find home health or in-home services through area agencies, or if it's just they need some DME or meds or something that they can't afford that I can assist them with. So when the patients are ready to leave the hospital, we contact the home health agency if they have chosen one and just give them an update and let them know what needs they have, like PT, OT, speech, bath aid, those kind of services. If it's the need for equipment, I reach out to locally here, the American Legion, and Pat works well with me, and he'll bring me donated items so patients don't have to make that cost out of their pocket. Or I work with Nicole Baum, our foundation director, and use the Hometown Heart Fund if we can't get the resources free or locally. Mental health of patients, when they're on the floor or they come to me in my office, sometimes we're limited with what we have here locally. We offer behavioral health here at Holton Hospital in the family clinic, but some people don't like telehealth and they just want to talk to somebody one-on-one, and sometimes it's not even like long-term. They just want to pop in once in a while and check in with me, and that's fine. I schedule those patients just for one-on-one meetings. They come in, we chat, we make a goal, set some things in place, and we just make sure they're meeting those, and I'm just walking beside them throughout that. And if they need something more intense that I can't offer in my office setting, then I refer them out to other options. Connecting patients with resources is another key part of my job. I help them navigate things like Medicaid, disability benefits, and food assistance programs. Sometimes the hardest part of getting help is knowing where to start, and I'm here to make that process easier. So I do work with a lot of families during difficult situations, especially if somebody's at the end of life stage or they just gotten a brand new diagnosis of something health related. I go in and I sit and I'm there in their space. They're going to lead me into what they need. I'm not going to come in and tell them what they need because they are the expert in their lives. Beyond my work with patients, I also help raise funds for United Way, which is really important to me. The funds we raise go directly into supporting local programs that make a difference in people's lives, whether it's helping a family get back on their feet or providing educational opportunities for children. I also love getting involved with the staff and wellness events. Keeping our team healthy, both physically and mentally, is a big priority. Whether it's organizing a walk or hosting a mindfulness session, these events help us all recharge and stay connected as a team. A lot of them have become my friends and people that I feel that I can confide in. The doctors are wonderful and easy to work with on a level of, professional and personal. The nurses are always willing to jump in and help me in any kind of way. I just have to say, hey, I need this, and there they are. I work with a couple of great case managers, Brianne and Sandy. So when we're talking about bridging between the hospital and community resources, I think I'm the face of our community service and our social service. People reach out to me because when they think of helping, they think of social work. So I'm just always that person that can be like, yes, we'd love to do that. We'd love to help your organization, and community is what the hospital really is here for. We're here for our own people and making them feel better. At the end of the day, one of the things that I always love to go home and think about is that somebody came in and they felt awful, and we were able to help them feel better. They came in here and they thought, well, this is it. This is the end. And we came in and we helped them build that strength, get the resources they needed, connect their family with resources they needed that maybe they didn't know they needed. and then they get to go home and continue to live the life that they wanted to live. And sometimes that means that we send you home with comfort care, or it's not always about continuing to fight the battle, but we've helped you accept the battle or help you accept the changes that are coming.